Thank you for listening to our presentation today. How should we approach or operationalise generalism in medical education? A narrative review of international policy and mission documents. This was conducted by a team across the UK and Canada as well. Why did we conduct this study? There is a lack of understanding about what generalism means, how it applies across disciplines, and how doctors should be trained as generalists. Recent events have demonstrated the need for generalists, and the concept of expert generalist practice is gaining traction across literature. We decided to examine how generalism is characterised within undergraduate and postgraduate medical education and health policy documents. We conducted a grey literature search and looked at documents from 1999 to the present day. A total of 35 documents were identified. Our early findings show that there has been a long-standing demand for more generalists to meet the needs of an increasingly complex population. Earlier documents tended to focus on primary care. However, there has been a shift over time, with more documents describing generalism in both primary and secondary care settings. Challenges include a lack of understanding of the role of generalists. Some documents may position generalism as a basic skill set, whilst others describe it as expert generalist practice. However, most organisations advocate for greater generalist training. Our early conclusions indicate that, whilst generalism is described as important, a clear definition and approach to developing expert generalist practice is lacking. Doctors of the future will be expected to develop broad generalist skills. Motivation of staff is important, with older documents describing issues such as pay and lack of prestige. However, generalism is increasingly recognised as complex. Physicians' roles must be considered alongside the roles of other healthcare professionals who work in generalist practice. Finally, the likely direction for all undergraduate and postgraduate trainees is towards greater exposure to generalism. Thank you very much, and please feel free to look at our poster.